Hi, everyone. I am Stacy Hurt, Senior Health Advisor at OSP, and I'd like to welcome you today to our latest installment of Healthcare Leadership Insights. I am joined today by a good friend of mine, a man who probably needs no introduction if you're following along in the digital health world, my friend Jamie Edwards. Welcome, Jamie.
Hey, Stace, good to see you.
Thank you so much for being with us today.
So
Lot of
excited to be here.
A lot of people have signed on for this one. We're going to have a lot of fun. We're going to dive into a lot of different topics. And Jamie and I want to just talk a little bit about how we know each other. We are real friends. So Jamie and I were both named to the HIMSS Digital Influencer list back in 2020. And of course, I got named to this list and had about, 10 followers. And so I started looking at all the heavy hitters that were on this list with, tens of thousands of followers. And, I started to connect with my other influencers, my co-influencers. And one of the first people that I connected with was Jamie. And I'll never forget our conversation. We got on the phone. I live in Pittsburgh. Jamie's originally from Buffalo. And I just felt like we knew each other our whole lives. It was a real connection. So we became instant friends, and Jamie has completely championed not only my work, but really the patient voice in general. And I think that's what makes him really a true advocate and a friend across the entire healthcare community is what you do for the patient voice. I know we appreciate you.
Super important voice that needs to be heard more often.
Thank you. Thank you. Jamie and I both serve on the Telemed Now advisory committee. We have a Twitter chat the first and third Wednesday of the month. We got one coming up tomorrow, #Telemed Now. We'll get into that in a little bit later. But most of all, Jamie and I have decided that we are the only two people who did not attend Vive or HIMSS. So we decided, just since we weren't at HIMSS, that we would have a conversation today. So let's dive into it. So anyhow, welcome, Jamie. How are you doing today?
I'm doing great, Stacy. Really honored to be here. Thank you to OSP and you for, providing a framework for us to have these discussions. It's an important dialogue that needs to happen now.
Awesome. Awesome. Before we dive into your story real quick, as I just said, we're the only two people not at Vive and HIMSS. I just want to kind of set the stage just for maybe some of the trends that you're seeing right now, maybe some things that were talked about at Vive, being talked about at HIMSS. What are just some Jamie Edwards hot takes right now, what you're seeing?
Yeah, well, despite me not being at Vive, the rest of the Startup Health crew was in force. And in fact, Startup Health and Vive Health have a partnership where Startup Health is basically the startup part of those conferences. And so there's really vibrant discussions that were happening, and I got the full debrief from my team. I think one of the things that we were seeing is that there is a rise in what I would call disease-specific companies that are going after specific states in a digitally enabled clinic model. So we've seen companies like Salvo Health or Oshi now in GI, and a few others in cardiovascular. And I think the rise of that is really intriguing because they're really going after the payer markets and figuring out how they can be what is a more efficient care continuum for those patients that have maybe these chronic conditions that previously weren't really being managed as actively as they could. And clearly, when you're talking about GI issues or cardiovascular issues, it's like these are issues that face most of the population. And so they're attacking what are very large patient bases and trying to create better experiences there. I think the other thing that we've seen are there are some amazing new technologies out there in remote patient monitoring. So full disclaimer on this next one is I'm advising two companies in the space. One is called Circle Health, which has a ring that has 10 different things it can measure and literally puts a hospital on your finger. So think Oura Ring, but really for the clinical environment. It's really interesting from that standpoint. It solves what is a big problem with current remote patient monitoring devices that don't properly measure pulse ox due to skin pigmentation. And pulse ox is one of the main things that we look at in a remote patient monitoring device. And right now, there's not a lot of health equity around that specific vital sign, because the current devices in market, the Apple Watch, Oura Ring, Whoop, they don't adjust for skin pigmentation and give you the ability to actually, if you're Asian, African American, anything non-Caucasian, your results simply aren't accurate. So Circle solves that issue, which is a big issue for it to solve. And the other, and this is going to get a little racy, Stacy. So I don't know
Hold
if
on.
you're ready for this.
Sitting
But
down.
the other is a sexual health company called FirmTech, which is actually launching today. And I'll let our esteemed listeners draw their own conclusions here. But as funny as it may be, a human's private parts actually have clinical implications and can be early warning devices of larger vascular issues, heart issues, regular circulatory issues. And this is really the first company focused on a truly clinical approach in this market. So it's exciting times for remote patient monitoring.
I think that's amazing. I mean, as a colorectal cancer survivor, and it is Colorectal Cancer Awareness Month, everybody gets screened. I would be remiss as an advocate if I didn't urge everybody to get screened.
I have my colonoscopy coming up, Stacy.
I am
I can't
proud
believe
of
I
you.
just said that to all the people on the webinar, but it's true.
I just bring this out of people. I just make people just feel comfortable to share. But that's, back to FirmTech. I just think every part of our bodies are beautiful. Every part of our body should be talked about. And, poop is not off limits. I always tell people in my advocacy work, your blood work and your poop tell your whole health story. I'm not afraid to talk about it. So
Truth.
I think that's amazing that they're getting in that space. So, all right. Well, that is a great way to kick off. So Jamie is the COO now of Startup Health. But prior to that, I know that, you are an entrepreneur and you started Cloudbreak Health, but I wanted to go way back. I just want to hear your whole life story and, your education, your career, how you got to where you are today. Go ahead and walk us through.
Yeah, well, I mean, look, Stacy, we only have 45 minutes here or an hour, so I could speak on that for a long time. But, I grew up in Buffalo, New York, which was a very normal place to grow up. And I actually attribute a lot of just my current work ethic and general attitude about life to growing up in Buffalo. And one of the things that my mom and dad made me do very early on was get a job. And so I was one of my first friends to be out getting a job. And my first job was washing dishes. So it's kind of as opposed to everything I needed to know about life I learned in kindergarten, for me, it was washing dishes. It was a foundational job that really taught me that no work was below me, and that, you can grind it out through what are very tough jobs, to whatever is on the other side of that position. And it's, everything's a starting place to some other great place that you can go. After washing dishes, I went to Cornell for undergrad. I took an entrepreneurship class there with a hallowed entrepreneurship professor, this guy, David Van Daniel, who unfortunately is no longer with us. But he taught me about the power of entrepreneurship, which is taking an idea in your head, making it real, and then making it matter and impact people in a positive way. And, Stacey, how many times have we said, oh, I have that idea. Oh, those guys, I had that idea 5 years ago. Well, the difference between an entrepreneur and the person having that idea is the entrepreneur takes the risk to make that idea real and make it matter. And there's something very real and tangible there. So the second I wrote that first business plan, I was hooked. I waited tables all throughout college to pay for my college expenses. And it's kind of again, everything I knew about life, I learned from the restaurant business. I learned how to deal with, all sorts of different types of people, and that service mattered. And I think it really provided the foundation for what became my servant-oriented leadership style, which we could call server-oriented leadership if we want to. But that's really what ended up driving me. But one of the things that I learned in undergrad is that I was an organizational behavior major. So I thought I was going to be a corporate psychologist of sorts, an organizational development consultant, something like that. But I grew up in the time of Enron. And after writing this business plan, I realized I didn't have any finance or accounting, and I didn't want anyone to be able to pull the wool over my eyes. And I wanted to be able to speak the language of the CFO. So I ended up going into investment banking and private equity for the first 10 years of my career, learning how to raise capital, seeing how, great companies are run, seeing how poor companies are run, trying to discern the differences between those. It was really a wonderful training ground. But I eventually left that to become the CEO of an ER group in Southern California that was founded by my uncle. So, yay, nepotism on giving me my first opportunity to actually run a company. I think, though, that that investment by my uncle and me has paid off. We grew the company from 12 million of revenue to 150 million of revenue in an 8 or 9 year period. And I really saw firsthand the troubles that were facing our medical system. And I really cut my teeth on the provider side of medicine. And I saw providers suffering from burnout. I saw providers who were being asked to do more with less on a consistent basis, see more patients, get paid less, try and push more widgets through the system, if you will. And that to me was a huge turnoff. And it was me from the outside seeing my doctors who were just trying to get through their shifts in the ER, reminding them of all this amazing work that they were doing. And so while we were running this business, we ended up founding Cloudbreak Health. My co-founder, Andy Panos, founded Cloudbreak's predecessor company, which was called Language Access Network. And that company was really centered around resolving health disparities. And the first health disparity it was targeted at solving was making sure that limited English proficient and deaf and hard of hearing patients had the same standard of care as their English speaking counterparts. And that is an issue that he faced when he went down to Mexico. His family was involved in a car accident. They couldn't speak the language, and a bunch of anxiety, stress, poor patient care ensued. And so we saw how fundamental communication was to that patient provider encounter. And in fact, communication is the number one diagnostic tool that a doctor has. If you look at a patient chart these days, it's the history of present illness, it's the family history. It provides the context around what the problems with that patient is or what that patient's chief complaint is. And it is what builds a trusted relationship between the patient and the provider, where the patient feels comfortable talking about their colorectal problems, right? Or whatever it might be. So we realized that we were solving what was a huge problem. Eventually, we built Cloudbreak to well over 2,000 hospitals across the country. It was a pioneer in its space. And we merged it into a SPAC called UpHealth, where it currently sits today, traded under the ticker UPH. And I ended up leaving to go kind of seek my new future, which for me as a social impact entrepreneur was, how can I increase my impact at scale? Success and the opportunity to be inspired every day by the work that the health transformers were doing, which is what Startup Health refers to their entrepreneurs as, was amazing. So instead of working on one company, I can now work on 400. And instead of standing on the shoulders of others, I can now let others stand on mine. And for me, there could be nothing more gratifying.
Oh man, that's amazing. You touched on so much there. I think this is why you and I bond, is because we both waited tables. What I got from all of that brilliance that you've done is the fact that I tell everybody that they should be a server, waiter, waitress in old terms, a server, and work for a nonprofit. I tell everybody that everybody should go do those for a year. You learn everything.
I couldn't agree with you more. Stacy, just to throw out an idea here of what I think could fix a lot of different things. I think it'd be really interesting if in the United States, we implemented a year of service as a requirement, right? Doesn't have to be the military, could be AmeriCorps or whatever it is, but I think it teaches people to value their place in their community. And I think it could be something that could be really productive. I would have loved to have, gone to build a bridge somewhere or worked for a nonprofit in a community, trying to raise that community up. And now I get to do that professionally, but I would have loved to do more of that when I was younger too.
Agree. I mean, what I heard from that, you and I are both self-made people from blue collar towns. And like you said, it is definitely that mindset of servant leadership. And I think that's what helps us relate to so many different people with so many different backgrounds is that we were in the trenches, we were
Yeah.
doing the work, and with all kinds of different people with all kinds of different backgrounds, like you said, different languages, and and connecting those dots, and building those communities, which is we continue to do, you and me. um
Yep.
we're talking to Jamie Edwards, everybody. Please, I didn't say this, but if you have a question for Jamie, drop it in the chat. Jamie and I do not shy away from the tough questions. We will take them on. If we don't hit on them during our dialogue, we are going to save some time at the end for them. So please, I see a couple coming in. Send us your questions. So Jamie, as you were going through that so much, with your uncle's company, and then, building Cloudbreak, now onto Startup Health, um, what would you say are a couple of the biggest challenges that you encountered throughout your entrepreneurial journey?
Ooh, loaded question, Stacy. I will tell
I
you that
said the
at the
tough
time,
question.
yeah, you do. You're bringing the heat. I'll tell you that at the time, every challenge felt like the biggest one. When you're going through building a company and you don't have the perspective of, what these big challenges look like, everyone feels like a big one. And they all made me question everything and shook my confidence to the core. And despite my confidence being shook, people were looking to me as a leader of an organization to know the answers. And I don't think they realized a lot of the time I didn't know the answers. I was making my, using my judgment and taking my best guess at
Sure,
it. But I
sure.
think all of that taught me that I could take it, that more than ever, I needed to step up and lead in those situations. And that more than anything, it was like my team and my mission meant everything to me. So you put revenue aside sometimes because your mission is more important. And those are really defining moments for a company. So I always say it's really easy to run a great company when everything is going well and your revenue is growing at 50% and you've got more money and you're fully funded. But really great companies are defined by moments of challenge when
Mhm.
they have to make um, those trade-off decisions between, well, do I sign up this company as a partner if I don't fully believe in the revenue, but I really need that revenue, but they're not completely aligned with our mission, right? Like those are the moments where you define yourself as a business, as a company. And I'll tell you, it was really foundational for us at Cloudbreak when we went through the Black Lives Matter moment in time when we held our town halls. And I'll tell you, foundationally for me, it was some of the most powerful work I've ever done in my life, to sit and listen to my teammates who are affected by this. And we were all sitting there on a town hall crying together, listening to their stories, and really connecting with these issues and coming together behind them. I mean, if you thought about what Cloudbreak was, we were really diverse to begin with. We're a company that had 250 different languages on our platform, people from all different cultures and races and backgrounds and political beliefs, but we all rallied around each other at this specific point in time. And it was definitely one of the most powerful experiences that I've ever been a part of, that launched what was, Cloudbreak being a very progressive company in the DEI space. So a lot of things to be proud of there.
Wow. You, like I said to our audience, we're real friends and we talk about a lot of different things. And I just think that you touched on some things that we should all believe in, no matter where you come from, what your political beliefs are, what your religious beliefs are, how you look at money or spending, et cetera. But there should be these fundamental things that we all believe in, and that unite us to do better in the world. And especially when it comes to healthcare, I mean, you look at the COVID-19 issue and everything. I mean, that's not a political issue, that's a public health issue.
That's
And,
right.
we should all find a way, to contribute to that, and end this pandemic for sure, or
Well,
navigate.
Stacy, I mean, to that point, right? Think
Yeah,
about COVID-19 was a tragedy,
yeah,
right? But there was a
yeah.
moment during the tragedy when I saw rays of hope, when we were one human race across a planet, right? Where no one was
Mhm.
talking about their differences. It was like, no, we need to find a way to all lock arms.
Yeah.
And we put trillions of dollars of GDP aside, industries shut down, all in the name of us working together on fighting something that we couldn't even see with our naked eye. Um, to me, I was like, that filled me with a lot of hope, knowing that that type of sense of tribe was possible.
Yeah.
And I'm looking forward to, continuing to perpetuate that, because I think it's really important that we all realize that we're one community.
Yeah, absolutely. And that kind of a devastation brought out the best in humanity, I
Right.
mean, and I mean, we can talk, on a compassion scale, but getting back to our conversation, I mean, looking at the innovations that came out of it, so quickly, and that we were able to, we always, you and I talk about the telehealth thing, and I wanted that for 15 years, and suddenly in a couple months it happened. So it can
That's
be
right.
done. We can do these things. But let me get
Yeah, it's
back
kind of
to
like
you.
necessity is the mother of innovation, right?
I love it. I love it. Oh, I feel a quote coming on. So I feel a tweet coming on. Um, so looking back, we talked about challenges, and again, hitting you with the tough questions. I'm just going to keep going.
Yep.
What would you have done differently, if anything, Jamie? And maybe out of that, what you would have done differently, and then giving our audience some advice through that.
Yeah, look, I think hindsight is always 2020, Stacy. And I was servant-oriented leadership again, right? So I was a born pleaser, if you will, and I always wanted to like build consensus and make sure everyone walked away from a situation as happy as they possibly could be. And looking back on it, I think there were situations where I should have been more okay saying no. There were certain situations that demanded me, as opposed to being a consensus builder, to just say no. And in life, I think we're defined just as much by what we don't do as what we do. And there were many times where I let myself get talked into situations that were completely avoidable if I had stuck to my guns. And I think there are times, again, we talk about company defining moments before, there were personally defining moments where I think I could have made a better choice. But each situation has made me a better entrepreneur. We learn from our experience. And I really tried to learn from each one. I mean, the list is long of mistakes this guy's made. I'll tell you that right now. But I think you really separate yourself out from your peers by how you respond to your mistakes. And what I've tried to do is not make the same mistake twice, right? So learn from that mistake, internalize it, debrief, think about it, and figure out how I'm going to then institutionalize it so either I or the organization doesn't make the same mistake again. But I think it's really about how you respond to those mistakes, because mistakes happen. They're going to happen. No one's got a crystal ball. No one can see the future. There are times where a platform goes down, and some of those things are unavoidable. But how you respond in those situations is really, to me, what matters. So, I've really lived a life of always trying to do the right thing, and respond in those situations by being humble, by not blaming, and by really just taking responsibility. There are things that happened in our company that were done by other people that at the end of the day were my responsibility. And while it might have been their failure on that specific task, it might have been my failure for not instituting the right culture or not having the right oversight. So I really take all of these mistakes very personally, and try and learn from them in a really constructive way.
Yeah. Wow. That's I think that's true leadership right there. Accepting mistakes, learning from them, not making the same mistake twice. And like you said, you know, I I'm a leader too with you in my community. And it's like you said, it's everybody's looking to you to make that decision, and meanwhile, like you said, a lot of times I'm just making it up as I'm going along.
That's right.
You're such a mentor to me, and we've talked a lot about imposter syndrome, and you've
Yep.
said you've suffered with it as well. I'm not the only one.
You are
So it's
not. You're in good company.
that's so humbling. So no, that's great advice. It's great advice. So, all right. So I always like to keep things real basic. There's
Yep.
a lot of terms out there, industry terms. And if there's one thing that's important to me, it's, literacy. I talk a lot about health literacy, digital literacy. Now we're going to do a little bit of VC literacy for our
Ooh,
audience and for
okay.
me as well. Like selfishly, I'm just going to tell you that this is for me as well. But so number one, the big term we hear is a SPAC. So
Okay.
tell us, what is a SPAC? What does it do? What's the implications of SPAC? What is a SPAC?
Okay, a SPAC is a special purpose acquisition company. And SPACs are publicly traded entities that do IPOs, initial public offerings, to raise money with the mission of deploying that money in a specific industry to acquire a business. Okay. So there might be a SPAC advisor out there who's got a given set of expertise in healthcare, and they say, we are going to go out and raise money to go out and acquire a digital health business focused in the telemedicine space, right?
Okay.
So they will then go out and raise 150, $200 million, $300 million. That then will start trading as a public entity. And it usually trades around $10 a share because that's the value that they're pegged at of the cash in the trust. So all this money that comes into the IPO goes into a trust account.
Okay.
They then have a certain period of time to go and find a business to bring into the public company and acquire. Usually it's around 2 years. So while they're looking for this business, the stock continues to trade at around $10 a share. They then will make a announcement about the business because they will have gone out and interviewed 30, 50, 100 companies, whatever it might be, to see which ones they want to pull in. They will diligence those companies. And then they will affect the transaction and make the transaction announcement and pull the company into its public shell. At that point, when the shareholders vote, the shareholders can either go and take their money back out of the trust, or they can leave the money in the trust in order to stay with the public company and let their investment ride, if you will. And in fact, those investors typically get a certain number of warrants for even investing in the company in the first place. And a warrant is basically a free equity option for all intents and purposes. Okay. So even if they give their money back, they still retain some ownership in the company. But so in order to hedge against all the money coming out of the business, the SPAC will go out and raise a PIPE, which is public investment by a private equity. It's a private company investment in a public entity. Let me rephrase that. So then a private fund will come in and invest in the business in order to provide working capital or whatever that business might need going forward. So that's usually how those deals are structured. And then the transaction becomes effective and the company starts trading as a public company.
Okay. Okay, cool. I think I got all that.
Okay. If there are any questions, let me know.
Yeah. And for our audience too, if anybody didn't follow that, again, we're very approachable here. So ask us questions. But so along those lines, yeah, I'm a big Shark Tank fan. I can't watch a lot of TV. I have an 18-year-old son. He's a senior in high school, and we make Shark Tank required watching in our house because I just think that there's so many good business lessons from that show. So, you're at Startup Health, and so you're kind of like a mini shark. You're Jamie the shark. And
Okay.
so are there any, I'm starting a company or whatever, I'm an entrepreneur, and there's got to be, what I see on Shark Tank is like there's definitely a template, right? There's certain key performance indicators, KPIs, that they're asking for, that Mark Cuban's asking for all the time. So as you're looking at these companies, I guess, let me think how I phrase this question. What are some of those KPIs? What are you looking for? And even Jamie, like, what are some red flags? Like, give me some scenarios, like when you see that, the money they've raised is too much and they have no sales, etc. Walk me through some of those scenarios of, like I said, some of the things you look for when you're looking at
Yeah.
these
So
companies.
Startup Health has a unique set of guidelines that it looks at, and they have, a very comprehensive metric overview that they will do when they're evaluating a company for Startup Health. We have scorecards, and these scorecards cover a broad variety of different things, including mindset, traction, everything that you would look at a company. We've impounded into these scorecards, but really what we're looking at most is the entrepreneur themselves. Because we are an early seed stage, early growth investor, what we're really talking about is, do we think this entrepreneur can execute against their plan? Do they have the right mindset? Is their mission pure? So team for us is really a key factor in evaluating whether or not we're actually going to make an investment. Because there's a lot of, and Startup Health, by the way, is structured around moonshots, right? So we have teams coming in who are saying, we are going to solve the greatest healthcare challenges of our time that the world is facing today. So you can imagine that some of these companies are brand new companies where they have an idea on a napkin, or they've worked on their product but it's not complete yet, but they are going after what are, they call them BHAGs, right? Big, hairy, audacious goals. And so team is a key thing that we use to evaluate there. The next thing is impact. And impact has, in healthcare, we talk about, triple bottom line impact or quadruple bottom line impact. In investing, it's a very similar type of thing. We've got financial, environmental, and human impact. Mm-hmm. And so it's really about how many patients can this company serve, how many encounters can they do, really those human impact, how many lives can be saved, right, would be a natural one for us to look at in terms of evaluating the investment. But then there's also environmental. I think one of the biggest things that was downplayed during the last, during the pandemic and during the telemedicine boom was the impact that telemedicine could have on the actual environment from a carbon footprint standpoint, right? It was something that was like largely ignored when we talked about telemedicine, but a huge benefit of having a digital front door for healthcare systems. And finally, there's the standard financial metrics, which are centered around, revenue growth, profitability, gross profit margin, things like EBITDA. You hear EBITDA a lot, which is earnings before interest, taxes, depreciation, and amortization, which is a proxy for a company's cash flow. Those are things that we obviously look at. With earlier stage companies, you're also looking at, from an investment standpoint, what's the runway of this company? If I'm going to invest X dollars, how much life does that give them until they need to be raising another round? Because the last thing you want a company to do is to raise money and then have to go and raise money again a short time thereafter. So there's a ton of planning that goes into it. It is a multifactorial evaluation, but it's something that we at Startup Health have really nailed from a systems standpoint to be able to evaluate these companies, and it showed off in the success of our portfolio.
Yeah. It's funny, again, I've watched Shark Tank forever, and you hear Mark and Barbara, Dame, you hear them all say time and time again that they invest in the person. That was the number one thing that you said, was you look at the entrepreneur and you look at the team, and they say that all the time, like, I'm investing in you. I believe in you. And I think that too. It seems like anymore, maybe I'm just getting old, but like within the first 5 minutes of talking to somebody, I can tell if they can, if they're full of BS or if they can actually do what they say they're going to do,
That's right. That's right. We all have that BS detector, right? And sometimes it's on high, and sometimes you can really very, very quickly gain a level of trust and respect for someone based on their track record, based on how they talk about their idea, their level of conviction, and whether you can actually relate to them and whether they can relate to the problem that they're trying to solve. I can't tell you how many great companies have been founded because someone had a personal experience that drove it.
Yeah. Yeah. I think that comes through, like you said, in the impact, in their mission. What is their, and then the sharks go on to ask, well, tell me your story and what's your background and how did you become associated with this? And like you said, when they're personally invested in it, you can't make that up. That comes through loud and clear. So again, staying with that theme, what are maybe some of the 3 most common mistakes entrepreneurs make, in the first couple years, or as they're getting started? Like what are some of the pitfalls that maybe our audience can avoid here?
Yeah, I think entrepreneurs need to go into being an entrepreneur with the understanding that it's going to be hard. Because I think we all start off with, oh my God, I have this idea, I'm going to start this company. And you hear these stories, and like, there aren't very many stories in the market. Like, the newspapers don't necessarily write about as many like failures in the entrepreneurial world. They write about the successes. And so you're like, oh, look, they started this company 5 years ago and then they sold it for $1 billion. Like, I'm doing that. That is one, not the right reason to become an entrepreneur. You have to have a problem that you really want to solve, that you're passionate about, and the financial success is the result of that, not the driver of it. So it's an important distinction. So, the list of mistakes, again, I think there are some really common ones. I think one, when we start off, we feel like we're takers of terms with people like investors. So this concept of no that I had brought up before was something that I, really wished I learned earlier. When you first start a company, there's almost like an embarrassment of riches with the opportunities that are in front of you. And I'll say it again, you're defined just as much as by what you don't do as what you do. So choosing and having focus is a key thing that a lot of entrepreneurs suffer from and that they can do more of. So saying no to opportunity A so that they could really focus on opportunity B. And in fact, I was really impressed. I was talking to a company the other day who actually turned down working with us because they're like, look, we're not ready and we're focused in this space right now, but we'll let you know when we are ready. And I was really impressed by that. I think that showed a ton of self-awareness and the fact that they were really focused on attacking a specific part of the market. I'll also tell you, I think not enough entrepreneurs go after revenue early enough. I've seen too many companies who are so focused on building the best product that they lose sight of product market fit. And all of a sudden they've spent $15 million and they have $100,000 of revenue. And you're like, guys, this math doesn't hunt. Like, where's your market? Right. Really important to be able to understand that you have to be in market with a product as soon as possible, because that's also going to inform your product development roadmap. So you'll get feedback from those customers that's going to shape really what you're going to create for them in the future. And if you don't do that early enough, you might be way off the path by the time you actually launch your product into market. I think not understanding capital structure and finances. There are a lot of companies who end up with upside down capital structures that then need to be restructured when they take that next level of investment. I think you have to have a modicum of understanding of what you're getting into with your investor partners. And in fact, we at Cloudbreak, we were really focused on finding the right partner, and we turned down higher valuation investors because we thought we had found the right partner with the one that we selected. And it turned out that we had. And then I think the final one goes into this servant leadership model, right? Not realizing that you exist to support your team, not the other way around. I realized very early on that I was there to make sure my team had the right coaching, the right mentoring, right access to resources to be successful. And if I wasn't actively managing talent and helping my team achieve their work and life dreams, I was going to fail because I wasn't going to be able to retain them, and I wouldn't be able to attract the best talent and set up the best company culture and all those different things that make a company successful. So, for me at Cloudbreak, like, I was very clear with everybody all the way down to our interpreters that I was there to serve them, not the other way around.
Yeah. Wow. Just so much you said there. I loved, especially I always have this quote I say, that an imperfect something is better than a perfect nothing.
That's right.
So, you know what I mean? You sit around and you're like, oh, I want to make it just right. And I want to make it perfect. And like you said, you're putting more money into testing, or you're putting more money into development, when meanwhile, you should get something doable, just get it out there, get some feedback, get some audience get some buyer feedback, consumer feedback, and then change it and improve it. But as long as you sit around with nothing out there, you won't ever know how you can improve upon it.
It's such a great point, Stacy. And I remember, so I worked at Lehman Brothers, and when we were, in investment banking, and we were perfectionists. Like, you couldn't have a misspelling on one of your slides. Like, the models had to be perfectly correct. Like, we were perfectionists. So when I became a CEO, and I had been spaced out for my entrepreneurship courses and me writing business plans,
Sure.
My uncle, Dr. Irv Edwards, was the first guy who said to me, he's like, Jamie, don't let perfect be the enemy of good. Right.
Yeah, that's a great one.
And I say that to this day. It resonates with me. And it's part of being an entrepreneur. You will never have full and perfect information about a market. You will never have full and perfect information about your product. But the point is to get something into market that functions as well as you possibly can, and then use your feedback to continue to tweak the product, make it better, make it better, make it better. But at some point, you've got to launch. And if you don't, then you're going to suffer from, that perfection that you're trying to strive for.
Right. And
it's totally counterintuitive.
Yeah. Yeah. At some point you got to pull the trigger and you just got to go. Right. And that comes from a thoughtful plan. And like you said on your last point, a great team. I mean, I'm a big believer in that there's no I in team and that you're only as good as your team. So you should try to support them as much as possible. And I always would say to my teams when I was a manager, I would never ask you to do something I wouldn't do myself. I'm not going to ask you to make coffee or copies or whatever if I'm not going to walk over there and go do it myself. And I'm always going to support you.
Stacy, some of this stuff sounds cliche, right? Some of the stuff we're
Yeah.
saying, but it's cliche for a reason. Like there's real data behind that sentiment and that strategy, right?
Well, I think that so many people kind of get over the handlebars with like really complex, notions and theories and everything. And Jamie, as you know, I'm a big believer in basics.
Yeah.
I'm a big believer in, does everybody understand what we're doing? And are we all on the same page? And it's okay to go back and ask if you're not, let's talk about it, because those are the fundamentals that are going to be the foundation of everything else that you build, right? So if you don't have sound principles from the beginning, then
Well, by the way, pride, Stacy, gets in the way of a lot of progress. The fact that we might be ashamed to ask a question or say that we don't know. I've
yeah,
always been impressed with the people who say, well, I don't know the answer to that. I've got to find that, not like making something up on the fly to like fill the dead space that might have come with the question when the answer is, oh, you know what? I haven't looked at it yet. I always have a ton of respect for people who know what they don't know, and
yeah.
then can either access the right people who do, or at least have that understanding that they're not trying to fill that gap themselves.
Right. I don't think, I say this a lot, vulnerability is not a sign of weakness. Admitting
Sign of
what you
strength.
know, it is. It's a sign, it even more so leaning towards strength of admitting what you don't know and going back and asking a question, because I think that people just start to like perpetuate the mistakes get bigger and bigger and bigger. When I grew up Catholic, and I'll never forget when I was in second grade and I made my first Holy Communion, or my first confession before my communion. I went to the priest and I said, I have this habit of lying, and I don't mean to lie, but I just kind of lie to cover up some things. And he said, the problem with telling a lie, then each subsequent lie becomes a bigger and bigger and bigger lie. And
That's
you have
right.
to keep your entire story straight all the way through and cover up all the little lies. So it's just easier to tell the truth. And
Stacy, I've been trying to teach my kids this. It's like we debate things all the time in our house, in what is a really constructive discussion. But I'm like, look, you're fighting me on emptying the dishwasher, but if you would just do it, we could deal without the lower stress of, the situation. There's
yeah,
something to be said for like all the lessons that you learn going throughout life where like it's easier just to be honest the first time around.
it is. It is totally. And get the basics right. Uh, All right, we're going to pivot a little bit. I alluded earlier that we're both on the Telemed Now Twitter chats,
Yep.
and so let's talk about the future of telehealth. I think we just started seeing some legislation now that's going to extend past the public health emergency, which is good news. So I just want to get an update, Jamie, on what you're seeing as far as telehealth goes. Is it going to stick around? What do we have to do to ensure that? What it's going to look like? Just your whole unpack on telehealth here. Little update.
Yeah. Look, telemedicine is here to stay. There have been a lot of expressions. The toothpaste is out of the tube, et cetera.
You're the big genie out of the bottle. You
Genie's
coined
out of the
genie out of
bottle,
the
all of
bottle.
those things that you can be out of or you can't go back in, right? It's like those are things that we're talking about here. Telemedicine and telehealth can't be looked at as point solutions in healthcare. They need to be thought of as a broader part of an ecosystem that follows a patient from home to the hospital and back again. You can't use telemedicine in a vacuum and call it a solution. It's really part of what is the broader continuum of care. And I've said this a ton and I'll say it again. We'll be successful when telemedicine and telehealth are simply known as healthcare. Just another tool that provides the ability to meet patients where they are on their terms when they need it, a digital front door that helps a patient navigate and wayfind to their in-person visit, and then allows the doctor to, do post-discharge care after the visit. or during the visit, bring in a specialist, on the screen with them that might not be in that specific geographic location. The fact of the matter is, though, we have this whole system that's built around in-person visits as the gold standard, and that's simply not true anymore. The gold standard is the best experience and the highest quality care for a specific chief complaint and a situation. And in many instances, that's a digital visit, plain and simple. You can't tell me that if there's a low acuity case that someone needs to go into the ER for that. It's simply not necessary. And there's a lot of situations where telemedicine is the right modality for that specific complaint. And so to make this happen, a few things I think need to occur. One, training on digital health visits in medical school and website manner training. Right now, it's simply not a skill that a lot of doctors have when it comes to digital health, how to use these tools in the right way. Regulations that you just mentioned that allow us to properly support our nation's healthcare system, sharing resources across the country and allowing us to load balance. New payment models that incent the right behaviors regardless of treatment medium. It's really hard for people to give up revenue. But look at what Kaiser and the VA have done pre-COVID, where they saw over half their patients via digital health to begin with. They could do this because they were value-based care systems, fully integrated across the organization. But problems occur in community medicine as people work in silos and we're fighting for healthcare dollars. And the irony of competition in healthcare is it sometimes breeds the opposite that what the market should do. It breeds in healthcare inefficiency, poor experience, lack of access to care and health equity. It goes against everything that we were taught in our economics classes. So I think there's still some wood to chop when it comes to achieving what we want to achieve with it.
Yeah, yeah. That's really what bugged me the most about telehealth is that, it was always the right thing to do, but the fact that revenue and reimbursement was the main driver. And listen, I'm a capitalist. I have a business degree. I'm all about it. But at some point, you have to balance what is the easiest, best thing to do for the patient with, okay, and then how can we get it reimbursed? Lead with the idea, right? And then figure out how it's going to get reimbursed.
Absolutely.
Yeah. I want to go back. I want to hit some questions. I know we're coming up to 10 minutes before the hour.
Yeah, let's do it.
Yeah, let's go up here. Of course, I'm going to start with this one from Hugh. I'm curious about the whole dynamic around consumer versus patient. And this is certainly a hot topic, Hugh. Thank you. I work in the CPG industry and our mantra is consumer is boss. But this doesn't appear to be the case in healthcare. What is the dynamic and how much of the future success will be determined by understanding the patient versus understanding the consumer? Ooh, gosh, I love that.
Yeah, this one, Stacy, you're going to jump all over this one in a
second.
second.
I am. Wait, can I answer? Who's the guest?
So I think there are a few things here. Yeah, I think there's a few things here. Healthcare is one of the only industries where the consumer sometimes isn't the patient, it's the payer. And so there's a misalignment because the patient isn't paying for care in certain situations, and in fact, in many situations. There's a disconnect there and some cognitive dissonance. So I happen to think that we will be successful in healthcare when we've created a system that's simple enough for the patient to understand. Right now, the healthcare system is overwhelmingly complex. And that complexity means that sometimes you need a guide to navigate it. And I think that's, by the way, really sad. We need to get to the point where there can be a lot of more self-directed decision-making and where the consumer and the patient merge into one, because the patient can have, make a more educated decision about their own care. And right now, I don't know that we in the United States have that system in place. We're seeing companies come up who are aiding in that pursuit, trying to, simplify the understanding of our healthcare bills so we understand what we're actually paying for, where we are in our deductibles, all those different types of things. But also, Google has been helpful and harmful, right, when it comes to self-diagnosis in healthcare. And we hear about Dr. Google a lot, but right now you still want to be trusting that physician in the room a little bit more than the technology when it comes to those types of things. So I think we're still far apart from the consumer in healthcare also being the patient. And so when you hear things like patient-centric care, there's a reason for that. And I think it still has to be the point of focus.
Yeah, yeah. Yeah. Okay. What's Stacy's 2 cents? Well, hey, thanks for asking. But no, I just think just what you said, Jamie. I mean, until we get to the point where we have a healthcare experience that's as easy as Netflix, Amazon, especially Amazon Prime, Uber, until we get to that level of convenience and choice and going on an app and finding our best experience and our best provider, we're a long ways away. I mean, these other consumer-based industries are doing it, and I do think we can do it in healthcare. Back to some of your points, if the incentives are aligned, if we're putting the patient first, if we're keeping the relationship between, this is one of my big lines on all my panels, is the technology should not replace the relationship with the physician. It should only enhance it and make
Yep.
it more flexible and more convenient. And we have to take into account always more equitable, and technology being in the hands of everyone, not just the privileged few, for sure. Let me go to another question. Working together is the energy that will bring us success. However, many aspects of the current work environment do not promote this mantra. How can we design our business model to generate sharing and working together? Oh gosh, I love that. I love that one too.
So I think that, there's nothing that feels better than working with a team, going after a goal and achieving that goal. So working together, like I'm an extrovert, Stacy. I know you probably wouldn't have guessed that, but I
I,
really fill
I
my
did know
cup.
that. Things I learned today.
I know,
Gee,
I know. I really fill my cup on being with other people. And all of my best experiences in life weren't things that I achieved on my own. They were things where we got a group of people together and did something, that where the sum of the parts was greater than anything we could have done on our own. So I think that this is about cultural design and what you can do in your own organization and how you choose to partner with other companies and how you behave in that partnership. It's about trust across boundaries. Um, I can't, God, given the world situation that's happening today with what's happening in the Ukraine and everything else, it's like, how can we build trust across boundaries and silos? Because it's when those silos and walls are in place that we end up in situations that we don't want to be in. And, for me, build a corporate culture that is all about people collaborating and about everybody's success together as opposed to their individual success. Build compensation models into your organization that pay for that pay for collaboration instead of paying for someone's individual contribution. And I think if we could start doing more things like that, we'll achieve that collaborative success model that we're all striving to do.
I couldn't agree more. It gets back to your leadership style, which was, building consensus. That I am the same way. I just, I just think what's so important for me, and I'm an audience member as much as everybody else, is hearing these things from you. It just really reaffirms, that if some of us are doing these things, we're on the right path. If we hear Jamie's doing them, he's at Startup Health, he's a COO, he's a big shot guy, and he's doing these things, I'm doing them, I should keep doing them. And like yourself, building consensus, building collaboration, and then ultimately, saying no to something, taking a risk and pulling the trigger and doing it, but also supporting your team. I think those are such important lessons and takeaways. I want to get to this one about, we did touch on telehealth. We have an audience member asking, what are the current guidelines for reimbursement for telehealth? And I do think that that's an important one. What is the status, the legislation that's extending, I think, for 5 months, right? Do I have that right, Jamie? Past the public health
Yeah, and look,
emergency?
it still is dependent on state. And I think what we saw during COVID was, people reimbursing in parity for telemedicine visits. And
Yeah,
if I think about what really needs to happen, and what most people don't realize is there's two parts to your medical bill when you go to a hospital. There's the professional component and there's the technical component. And the technical component is the payment for your gurney, the hospital room, all that infrastructure that is sitting there,
yeah,
the nurse, all of that is in the technical component of your hospital bill. The professional component is what you paid for your physician's opinion, diagnosis, and treatment. So for me, when I think about telemedicine and the way that it should go, the professional component, for all intents and purposes, should be the same.
Mhm.
Your physician, you're still paying for that physician diagnostic capability for them to use their best judgment, skills, and knowledge to, come up with what is the right treatment plan for you. That's the same whether you're in hospital or sitting behind a screen. The difference is the technical component, and the technical component for a telemedicine visit, well, that infrastructure should cost less, significantly less than the in-hospital infrastructure should charge. So
Mhm.
should cost. So I don't know that right now we're sitting in what is, the perfect position in terms of reimbursement, because what we saw was payers and everybody start to back down what they were going to pay for a telemedicine visit. I think we need to put a little bit more science behind it. Like the Medicare system evolved, as complex as it is, with some science behind their CPT codes and all those different types of things. And I think we need to do the same with telehealth, and we'll end up getting to what is the right place from a reimbursement standpoint. I think the interesting thing is that right now, as we move to value-based care, that
Mhm.
question kind of goes away, because telemedicine will just be one of the modalities. If you're, paying per member per month from a payer standpoint for a telemedicine service, um, you know, that's that's going to be covered as part of doing business. So the
Mhm.
doctor will be able to say, oh, well, I'm being paid $200 a month to take care of this patient, but I can see them for these things over telemedicine, and I can see them for these things in office. That's really the right model and the right future for our healthcare system.
Agree, agree. I want to get one more quick one in here before we do a wrap up. And of course, I would be remiss if I didn't say you got to follow Jamie on Twitter. Jamie Edwards, you got to follow him on Twitter. So much knowledge. You can follow me too, but I'm not nearly as exciting as Jamie is. Although I do light some people up, which is pretty fun. But let me get to
I
this
enjoy
last.
it when you do that. Sometimes you got to speak truth to power.
You do, you do. I'm not afraid. Hey, listen, I backed stage 4 cancer down. It takes a lot to scare me.
There you
Um,
go.
what main challenges have you seen digital health face that are different and unique than traditional therapeutics, devices, and diagnostics in going to market? Wow.
That is a that is a weed level question. So we're going to dive down here. I think when I take a look at the challenges that digital health faces, there's a general answer to that, which is culture. Healthcare is a risk averse culture. There's always the excuse that lives are on the line, so it's hard to experiment. If you do experiment, you need to do clinical studies. It's very evidence driven in its regimen. And even now, you're seeing traditional therapeutics. We're seeing the evolution of digital therapeutics, right? With things like companies like Applied VR, as an example, who are using virtual reality, as a device in hospitals to reduce pain and all these different types of things. So, I think the challenges that we face are largely cultural and getting people to change their practice patterns. And we faced this when I was at Cloudbreak. People were used to picking up the phone or calling an interpreter, or they were used to having that live interpreter in the room with them and having the comfort of having somebody sharing that physical space, and thinking that that was, again, the gold standard of care. So it took us a lot of mission driven selling to convince people that video remote interpreting sat at the middle of cost, quality, and efficiency, and that it was actually a higher quality modality in many instances, because you could have ready access to an interpreter in 30 seconds, whereas you might have had to wait 15 minutes, 20 minutes, 2 hours for an interpreter before, and still have the benefit of sight, because 70% of communication is nonverbal. Someone pointing to something on their body, seeing a grimace, taking their facial cues. So I think you're facing, to me, culture is the biggest challenge. And then following that up is regulatory, because a lot of these digital therapeutics that we're seeing, now they're seeking FDA approval. And while we had emergency use authorizations throughout COVID for these types of things, now we're coming back to, well, now you have to go through the standard FDA process. Now, that process is in place for very good reason. And those aren't insurmountable hurdles, but you need to understand that they are still real hurdles that you need to get through as part of your go-to-market process of your digital health company.
Wow. Well, you just summed that up very well, very quickly. I want to thank our audience for joining. I want to thank our ultimate host, OSP. Please, for your software solutions, consult with my friends at osplabs.com. They are here to help and build a comprehensive solution. And most of all, I want to thank my guest today, my friend, my mentor, an ally of mine. I can't say enough good things, Jamie Edwards. Thank you so much. You are a good friend.
Thank you, Stacy. I really appreciate it. There were some people who wanted to kind of engage with me online, so you can either hook me up on LinkedIn, or you can do Instagram or Twitter, which is just at Jamie Edwards for both. But thank you everyone for attending today. And Stacy, thank you for your amazing hosting capabilities, and to OSP for, again, making this discussion happen. Super grateful to have had the opportunity.
Thanks so much. Everybody stay well out there. Have a great rest of your week. Bye-bye.